Good afternoon, Mr. Smith. My name is Summer Stokes. I'm with the Georgia Southern Nursing Program, and I'm going to be conducting a head-to-toe assessment on you today. Before we begin, do you have any questions for me about anything?
No.
How are you feeling today?
Fine.
Okay, great. We are, usually it's a systematic approach. We're just going to start from the head and work our way down. If at any point you have any discomfort or you have any questions, feel free to ask, okay?
Okay.
I'll start by washing my hands. All right. So I just want you to look straight ahead at me. Look up for me. Look down. All right. On the eyes, conjunctiva is pink, sclera is white. No notice of any foreign objects. I'm going to take a pin light right here. And you're going to see a bright light in your eyes. Just look straight ahead at me. All right. One more on the other one. Okay, perfect. Pupils are equal, round, and reactive to light, so essentially pearly. Next, we're going to move down to your mouth. Lips are pink and moist. Open your mouth real wide for me. Teeth are intact, tongue is moist and pink, gums are also intact with no signs of bleeding. I'm just going to take this tongue depressor right here. Alright, if you'll just open your mouth real wide for me one time, say ah. Alright, uvula is midline and intact. Gag reflex present. Alright, next I'm going to move down and assess your neck. So just stand straight, or sit straight up for me. There you go, perfect. We're going to start by assessing the lymph nodes, so you'll feel me palpate on your neck. I'm just going to use the pads of my fingers. We're going to cover a couple different lymph nodes, so I will let you know which ones we're doing as we do it. So we're going to start up here in front of the ears with the pre-auricular. We're going to move behind the ears to the post-auricular. All right, we're going to move back towards the front to the parotid. We're going to move back a little to the tonsillar, down right under the jawline to the submandibular, and move right down to the chin to the submental. All right, we're going to move back around to the back of the neck, up here for the occipital. Move down a little bit further to the posterior cervical nodes. All right, and then we're going to move right up front, right above the clavicle for the supraclavicular nodes. All right, all nodes are mobile and non-tender. No swelling noted. All right, to continue our assessment with the neck, I'm going to have you lean back for me. Okay, perfect. I'm going to lean you back just a little bit. You comfortable?
Yep.
Okay. I'm just going to assess your neck. I'm going to do one side first. We're assessing for your carotids. So basically, I just want to check pulsatile blood flow up there. So what I'm going to do is I'm going to feel on the right-hand side of your neck. I'm just feeling for that pulse. Pulse is 2+. Now I'm going to move over to this side of the neck. I might sit you up a little bit so the video can see. I'm sorry.
No, you're fine.
All right, drop your hand for me. There we go. All right, I'm going to feel right here. Perfect. Pulse again is 2+ on here. Now I'm going to take the bill of my stethoscope and I'm going to listen to each side. Take a deep breath in for me, and on exhale, and then hold it. All right. Deep breath in for me. Exhale, and then hold. Okay, perfect. Pulse was detectable, but no bruit noted. All right. Next, we are going to move down to your chest and assess the anterior part of the chest, which is the front. What I'm going to do is just start off with inspection. I'm just going to watch you breathe, and you can just breathe normal. Okay, on inspection, breathing is non-labored, regular, respirations are even. All right, I'm going to move on to auscultation at this point. All right, what we're going to do is I'm going to start over here. I'm just going to listen using the diaphragm of my stethoscope. Deep breath in. And again. And again. And again. perfect. Lungs are clear bilaterally. Okay, next we're gonna assess the posterior chest. So what I'll have you do, just for the camera purposes, you can swing your legs over to that side. I'm gonna be looking at the back of your chest. Okay, perfect. We're gonna start with inspection again. So just looking at the chest, I'm looking for any kind of retractions, any shortness of breath, any signs or symptoms. Chest is symmetrical. Rise and falls equal, non-labored. Don't see any signs of respiratory distress. All right, next what we're gonna do is I'm gonna percuss the lung fields from the back, posterior. So you're gonna feel me, I'm just gonna touch your fingers and you'll feel me lightly tapping in the space in between your ribs, in that intercostal space. Move over. Might be hard for you guys to see. Turn that way a little bit for me. There you go. Okay. All right, perfect. And lastly, I'm going to oscillate the back posterior chest, same way as I did in the front, moving left to right. And when you feel me touch you, just take a deep breath in, okay? One more. Again. Again. And last time. All right. Okay, now we're gonna move along to the heart. What you can do is if you'll lie back for me one more time. I'm sorry, I know I have you moving a whole lot. Okay, perfect. So we are gonna listen, or I'm gonna listen to the different valves of the heart, 5 different points. We are gonna start, and I'm gonna talk. Right before I listen, we're going to start with the aortic valve, which is in this second intercostal space on the left side. And I'm just listening for that loop-dub, loop-dub. Okay, we're going to move over to the right to the pulmonic valve. Okay, and then we're going to move down a little bit close to the bottom of the apex of the heart for the Erb's point. Move down a little bit further for the tricuspid valve. And over to the right for the mitral valve. Okay, perfect. S1 and S2 noted with no murmurs. All right, last we are going to do the abdomen. So similar to the lungs and the chest, we're going to start off with inspection. So I'm looking for symmetry. Abdomen is symmetrical, contours round, no lesions or scars noted on there. Next, I am going to auscultate your abdomen. So you have 4 quadrants, and I'm going to listen to each one for vowel sounds. As soon as I hear gurgling, I'll move on to the next one. Perfect. Okay, perfect. All right, next I'm going to percuss the abdomen. So you'll feel me lightly tapping on your belly again, just as you did with the back of your chest. Let me know if at any point you have any discomfort or tenderness, okay? All right. I'll move back up the middle. Over and work our way down. Perfect. Lastly, we are going to palpate your abdomen. So you will feel me again touch you with my hands. It's going to be kind of, I'm going to use the pads of my fingers and we're just going to press gently. And then we will follow up with deep palpation, okay? And you're just going to move right to left on this one. Let me know if you feel any pain or discomfort. Okay. I'm just feeling for any masses or tenderness. Alright, now we're going to lean you back just a little bit. Got a better angle. We're going to do some deep palpation, okay? Harder. Alright, perfect. And again, no masses or tenderness noted? None of that was uncomfortable for you?
No.
Okay, all right. Well, that will conclude our exam for today, or our assessment. Thank you for your participation. Do you have any questions for me?
No.
Okay, perfect. Thank you. I'm gonna wash my hands. And you have a great day, sir.
Thank you.